Welcome to episode 3 of Clits and Coffee. I'm Zoe Palm McPherson. I'm a ortho physical therapist and pelvic floor PT.
And I'm Melanie Milstein, and I'm also an ortho and pelvic floor physical therapist.
So today we're going to talk about anatomy of the pelvic floor.
This is going to be a really great episode. We'll kind of give you some ideas of how you can check it out on your own anatomy, on yourself. We're not going through a physical therapy exam. It's really going to be about you just learning your genitalia and your anatomy and getting comfortable with that.
So a good way to start is lying on your back or like supported by pillows, kind of upright but comfortable leaning back, grabbing a hand mirror or sitting in front of a long mirror just so that you can get a view of your vulva.
Okay, so what we're going to start with, we'll pull out the model of the pelvis. We're going to just point out some bones that most people should be familiar with, but just to orient where things are at in your body. Starting from the front side, this is your pubic symphysis. So you can actually start, so you'd start feeling right at the top and then feel your way down, and then kind of when you feel that kind of shelf happen, that's when we'll point out some other muscles. But this can be an area of tenderness, so just feel around, see if your body has any tenderness through there. So that'll be the pubic bone in the front, and then if we flip around, we have the sacrum or the tailbone that leads into the coccyx down through here, and then up above is going to be your lumbar spine or your low back. And then all of these bones are going to meet to make up your hip joint, which leads into your legs. Okay, and then now we'll go into some of the other anatomy.
So if we're starting externally, mostly looking at vulvar area, so that's this area here, what we think of as kind of like what's known as the lips, there's two of them. There's the larger ones, which are your labia majora. They're gonna sit here and on either side. And then if you open up labia majora, you get into labia minora. And then inside that, so if we were to spread labia minora, that's where there's the area called the vestibule, and that's where outside skin becomes inside skin. It can be a little bit glossy, the color changes a little bit, and there's a little bit more moisture. In addition to that, we have the gland of the clitoris, but the clitoris actually then extends down this way, so it's much larger than most people think of.
Yeah. And then, so one thing that we also wanted to talk about was with, did you want to talk about the vestibule?
The vestibule, yeah.
Okay, sorry, just wanted to make sure. So with the vestibule, when we meet with patients, we like to really know exactly where their pain is. That helps us decide, is it pelvic floor PT that you need, or is there another medical provider that would also be helpful in your plan of care? So especially with the vestibule, this is an area that we really recommend to make sure that you follow up with the medical provider, as there can be other medical causes for pain or discomfort in this area. And then in which case, it might be that you need to see a medical provider to handle the medical reasons for your pain or discomfort, and then maybe us for more of the muscular side of things.
Yeah, and so as you're looking at that, just taking note of things like redness, and then you can keep track of changes in that color. Is it a little paler? Is it redder? Is there more or less moisture? And what does that tenderness feel like? So that you know, so that in the future, if things change, you have a more idea of what to tell your provider. Yeah. And then Melanie's going to talk about the first layer of the pelvic floor.
So the next part is going to be some of the muscles in what is known as layer 1, so the first superficial layer of the pelvic floor. And again, what we want to really have you do for what we're going to teach today is getting familiar with your anatomy and what feels, or what is your normal or your baseline. So a first muscle that we're going to point out is called your ischiocavernosus. Okay, so that's going to be starting at your pubic bone, and you work along the side through here, and you can do right and left side. Okay, that's going to be kind of almost where your crease is in your groin. You're going to go right on the inside of that is where you'll find that muscle. Okay, and then if you go a little bit more in, so we go inward from labia majora, closer to labia minora, you're going to go through a muscle called your bulbocavernosus, and same thing, you're just going to feel both sides and just get a feel for what those feel like for you. Then after we go through that area, we're going to come down to an area called your perineal body. This is going to be an area between your posterior vagina and your rectum, your anal canal. Okay, so feeling again for any areas of tenderness through here. And then you can also work through another muscle called your superficial transverse perineal, which goes through your perineal body all the way over to your sit bone. So again, feeling left and right side.
And the perineal body is an important place to take note of, especially if you've had any sort of tearing during a vaginal birth, because for a lower rate of tear, there's going to be tearing just close to that posterior vaginal area or posterior fourchette, and like a grade 4 tear is going to go into the rectum. And so it's usually somewhere along this perineal body. So you can just see, like, how is that moving? If I move the skin a little bit side to side, is there some discomfort from that scar?
Okay. And then our final muscle in layer 1 is going to be the external anal sphincter, which is going to surround the anal canal. Also can be a source of pain or tenderness. So that's the area that if you're going to feel, make that your last thing, and then you'd also want to rinse your hands off. Next we'll go into layer 2.
Yeah, so layer 2, this isn't a great model to see, but it's primarily muscles that control the urethral sphincter, but they also can come around the vagina. And in order to assess for tenderness, you're gonna have to go to a depth of about 2 knuckles, and you're looking more kind of like a clock, so hitting like 1 o'clock, 2 o'clock, 3, and just noting what that feels like. Is there any discomfort? Does it feel like you can't apply much pressure, or you kind of like are pushed out? And layer 2, along with some of the muscles here in layer 1, are super important for blood flow, and so being able to have sexual function, because they sit over that clitoris, so we need blood flow to the area for pleasure. They can also really influence tolerance to penetration, because if there's tension, that the opening of the vagina can close a little bit, and then you're unable to have penetration, or there might be pain with penetration close to the opening of the vagina.
Okay. And then our deepest layer, which is known as layer 3. These muscles are going to be commonly referred to as the levator ani muscles. We'll point out some of the important ones. Well, they're all important, but we'll highlight some of them. So again, just to orient yourself, this is the pubic bone, and then this is going to be the backside where the tailbone is. One of the muscles, okay, is going to be a muscle called your puborectalis, which is going to be on the inside, wraps all the way around to the back of the rectum. Okay, that muscle helps to maintain bowel continence. So meaning when it's relaxed, it's going to allow you to have a bowel movement, and if it's contracted, it's going to prevent you from having a bowel movement until you are ready. Some of the other muscles, there's one back here called your coccygeus, your iliococcygeus, that attaches onto the coccyx. And if you can imagine, what that's going to do is it's going to actually pull your coccyx underneath you. So you can imagine a dog kind of tucking their tail underneath. That's going to help move that coccyx underneath. This muscle can be really important and play a role if you have some of that tailbone coccyx pain that we had talked about last episode. And then our other muscle that we'll point out will be a muscle called, it's part of the pelvic wall. It's going to be a muscle called your obturator internus, which is going to be on the lateral side of the pelvic wall here. Okay, you can actually also palpate that or touch that, press on it externally. If you press on it from the inside of your sit bone, you can also feel that muscle through that area as well. That muscle is really, really important because it can play a role in the pelvic floor, and then it can also play a role, it's also a hip rotator, so it can also play a role in hip dysfunction or hip pain.
Yeah, so what she was talking about with palpating that externally or by your sit bone is if you find your sit bone and come on the inside of it towards your vagina and push down onto that bone. So it's this guy right there. And all of these are super important in looking at, okay, what's going on? Where's their tenderness? But then we always want to think about the why. So we're looking at, is there maybe some indications of labral pathology or like a tear in the hip labrum? Because that obturator internus is likely going to be tender and that can influence structures nearby. Or are we having hip pain because pelvic floor muscles are tight? So figuring out what's driving the symptoms and the why behind them so that we're treating the cause and then addressing that tenderness and tension in the muscles as a response to that.
Yeah, absolutely. And just, always making sure when we work with patients that we're looking at the whole person and not just isolating where their pain is, because that is a very, very small piece of the puzzle in why they are having pain. So it's really, really important to look at other structures outside of the pelvic floor, outside of the hip, to make sure that we're getting the full picture and how to best treat that person.
Yeah. All right. Well, this is the first episode of 2023.
Yeah.
So super excited for the new year and to get the ball rolling on this.
Yeah. So like, subscribe. If there's some things that you want us to talk about, hit us with a comment, and we'd love to have an episode on whatever you guys would like to see.
All right. Happy New Year.
Happy New Year.